Hello guys, so now we shall be discussing about the meninges of the brain, and we shall also discuss where the CSF is exactly located and how the CSF is produced, and once the CSF has been produced, how the CSF is traveling. So we shall look into all of these important things. Okay, so first of all let us discuss about the first few important things, that about the meninges. How many meninges do we have, guys? We basically have got three different types of meninges. All of you know that. The outermost layer is called as a dura mater. The next layer is called as a arachnoid mater, and the layer that is closely attached to the surface of the brain is called as a pia mater. So these are the three important layers which we have, and in between these layers also we have got some spaces. Okay, so let us discuss all of them now. Okay, so first of all let me draw the structure of the brain and then we shall discuss all these things. So let us say right. So this is just a rough picture of the surface of the brain, and these are your cerebral hemispheres over here. Okay, and after that, here at this location over here, all of you know that you have got your pons. So this is the location of your pons, and after the pons again, yes. So let us say, let me draw the pons once again. So this is the pons which you have, and after that this is the medulla oblongata which you have, and hanging down you have got your spinal cord in this way, right? Pons, medulla oblongata as well as your spinal cord. Now let us start drawing the layers. As the first layer which I will be drawing right now is the layer that is closely attached to the surface of the brain. So if you can see this layer which I am drawing right now, this layer is closely attached to the surface of the brain, isn't it? So this layer which is closely attached like this layer over here, you call it as what? This layer is called as your pia mater. So this structure which is coming down all the way is your pia mater like this. Now after the pia mater, the next layer we have got is the arachnoid mater. Yes or no? So before I draw the arachnoid mater, let us first draw another structure, that is dura mater, the outermost layer. What is the outermost layer? See, this is your outermost layer, isn't it? So this layer outermost you have got is a dura mater. Let us say this structure over here is your dura mater. Now remember one thing, guys, that dura mater, right? Dura mater actually it is double layer. Okay, for example, this dura mater exactly here, wherever the sutures are present, right? Let us say this is a suture which you have exactly near the place of the sutures. The dura mater will divide into two layers. For example, in this way, you see the dura mater is dividing into two layers like this. Yes or no? Right? So in between these two layers you see some potential space over here. Now this space is having a sinus, and this is called as dural venous sinus. Okay, so let me also draw that sinus right now. So let us say that here you have got a sinus like this. Okay, this sinus is having what? This sinus is having what? It is completely having the cerebrospinal fluid, and this sinus over here is called as dural venous sinus. Dural venous sinus. And on top of it, what do we have? On top of it, we have got the skull cap like this. Okay, so we have got the skull cap, and after the skull cap we have got the next layer. What is this? That is a dura mater. So at the place where the sutures are present, there the dura mater divides into two, and we have got the dural venous sinus in that. Okay, so let us say that this part over here is your dura mater like this. This part over here is your dura mater, and between the dura mater and between the pia mater we have got another layer, and that you call it as arachnoid mater, right? So let us draw the arachnoid mater right now. So this is how the arachnoid mater looks. So let me change the ink over here. Yeah, all of you look here now. So this layer which I am drawing right now is your arachnoid mater. Okay, so this layer in between is called as your arachnoid mater. Now when it comes to the arachnoid mater, When it comes to the arachnoid matter, you very clearly have to see here that this arachnoid matter will pierce the layer of dura. See, it is piercing. It is piercing the layer of dura and it is entering into the dural venous sinus, and it will end up as some very important structures in this way, like this. Okay, you see these structures which are coming like this. So what are these structures which I'm drawing right now? These structures which are drawing right now, these are called as subarachnoid granulations. What are these structures? These structures are called as subarachnoid granulations. Now see, this is how it is gonna connect in this way. Okay, so let me just rub this out so that this would be really clear for you. So these structures which I have drawn just now, these are called as subarachnoid granulations. These are the, or I can also call it as, these are the finger-like projections of the arachnoid matter into what? Into the dural venous sinus. And how it is entering into the dural venous sinus? It is entering into the dural venous sinus by piercing what? By piercing the, what is that? It is entering into the dural venous sinus by piercing your dura mater. So this is what is called as dural venous sinus, right? And these granulations which I have told you, these are called as subarachnoid granulations. These are called as subarachnoid granulations. Clear? Now, what is the importance of subarachnoid granulations? I'll tell you in a minute. But before that, let us just first draw these ventricles over here. What did I tell you? I told you that here in the central nervous system, in the cerebral hemispheres mainly, you have got two important ventricles, right? So what are these two important ventricles? We have got something called as a first ventricle as well as a second ventricle, like this. And the first and second ventricle are joining together like this. The first and second ventricle, they join together like this, and wait, what do they happen? These ventricles, they drain into third ventricle. You see, this is your third ventricle. Next, and the third ventricle also joins like this and drains in the form of a duct in this way, right? This is called as your fourth ventricle, and obviously the fourth ventricle is in continuous with your spinal cord. Clear? So this part which I have drawn here, let me highlight this part. See, this entire part which I have drawn here, this is what is called as your ventricle. So this one is your first ventricle, second ventricle, or simply you can call it as lateral ventricles. Okay, simply you can call them as lateral ventricles. And after that you have got your third ventricle. See, this is your third ventricle. Third ventricle is draining into which ventricle? Fourth ventricle. So in my previous classes I have already told you that where is fourth ventricle present? Fourth ventricle is present at the junction between the pons as well as the medulla oblongata. So that is a place where your fourth ventricle was present. Yeah, right. So these are the ventricles here. So let me just write one more important thing. One more important thing is that within the ventricles, ventricles are lined by some epithelium. Within the ventricles, there is a lining of some epithelium, hair-like epithelium like this. This hair-like epithelium is nothing but called as ependymal cells. Okay, so this hair-like epithelium which you can see, which is lining your entire ventricles, this is called as ependymal cells. Ependymal cells. Okay, next important thing is that within the ventricles, attached to the wall of the ventricles, you have got some structures, finger-like structures in this way. You see, there are some finger-like structures that are hanging down from the ventricles like that. These finger-like structures are also even present in the third ventricle like this. These finger-like structures are also present on the roof of the fourth ventricle. Okay, so what are these finger-like structures? These finger-like structures which are present in the ventricles are called as choroid plexus. What is the use of choroid plexus? I will tell you in a minute. Choroid plexus. So first of all, let me name all these things and then I will discuss the important things. So this is dural venous sinus, this is subarachnoid granulations, and this one over here is called as your dura mater, and this one over here is called as your arachnoid mater, right? And the innermost layer here, you call this one as your pia mater. And where is your cerebrospinal fluid? And by the way, this is your first ventricle, this is your second ventricle, and all of you know that this is your third ventricle and this is your fourth ventricle. We have got four ventricles. And next important thing is that all of you should know that where is the CSF present. The CSF is mainly present in the subarachnoid space. You see, this is the subarachnoid space, and subarachnoid space is having CSF. Subarachnoid space is having what? Subarachnoid space is having your CSF. So this is a CSF that is present in the subarachnoid space. Now, what is the important thing you have to know? The important thing which you have to know is that the first important thing is where is CSF secreted first of all. The CSF is first secreted by this choroid plexus. You see choroid plexus over here, right? This is the choroid plexus which will release the CSF. Okay, but during the time of development, right, during the time of development of the baby in the mother's womb, that time who is forming the CSF? The amniotic fluid itself acts as a CSF. Which is the first CSF in your body? The first CSF is nothing but your amniotic fluid. After the delivery, slowly this choroid plexus everything will be formed, and from then onwards choroid plexus start releasing your CSF. So this is the choroid plexus which starts, basically it starts releasing what? It starts releasing the CSF. You see, choroid plexus is the one which starts releasing the CSF. And what is going to happen here? This CSF, whatever is formed within the ventricles like this, which is formed within the ventricles, it will communicate with each other. You see, the CSF formed in the first ventricle can go to the second, formed in the second ventricle can go to the third ventricle. And all of you look here, the first ventricle and second ventricle are connected to the third ventricle, right? So it is connected to the third ventricle with the help of foramen of Monro. So this structure is called as foramen of Monro. And third ventricle is connected to the fourth ventricle with the help of aqueduct of Sylvius. Aqueduct of Sylvius. Now after that, you even can see some small openings on either side in the pontomedullary junction. This is called as foramen of Luschka. Foramen of Luschka. Okay. So what are the few important things you need to know? That the two ventricles, they connect to each other, right? And these two lateral ventricles connect with the third ventricle with the help of what? They connect with the third ventricle with the help of foramen of Monro. Third ventricle communicates with the fourth ventricle with the help of aqueduct of Sylvius. And within the fourth ventricle you have got foramen of Luschka. Okay. Who is actually releasing the CSF? CSF is released by choroid plexus. And this CSF which is released by choroid plexus, first it will enter into, remember the pathway, from the lateral ventricles, it first enter into the foramen of Monro, and from the foramen of Monro, it will enter into your third ventricle, and from the third ventricle, it will enter into your aqueduct of Sylvius, and from the aqueduct of Sylvius, it will enter into the fourth ventricle. And if you very clearly look here, this CSF from the fourth ventricle is going and it is coming out of this foramen of Luschka and finally entering into which space? It is finally entering into this dotted space that is called as what? Subarachnoid space. And from the subarachnoid space, the CSF will travel upwards in this way. I am drawing it with the black. You see, the CSF is traveling up like this, right? So it travels up, it travels up, it travels up like this in this way. And finally, I have already told you there are some structures called as subarachnoid granulations. So with the help of these subarachnoid granulations, the CSF will finally enter into your, where it will enter into your dural venous sinus. So is this the end? No. From the dural venous sinus, finally your CSF will drain into another important sinus that is called as superior sagittal sinus. Right? So when I discuss about the sinuses, you will understand. So it would drain into superior sagittal sinus. It would drain into finally superior sagittal sinus. Okay. So these are some of the important things which you need to know. So let us write down the pathway here. So what is the pathway? First, choroid plexus. From the choroid plexus, CSF enters into the third ventricle with the help of foramen of Monro. From the foramen of Monro, it will enter into third ventricle. From the third ventricle, it will enter into aqueduct of Sylvius. From there, it will enter into fourth ventricle. in the fourth ventricle, with the help of foramen of Luschka, it will enter into the subarachnoid space, and from there subarachnoid granulations, and finally dural venous sinus, and at last superior sagittal sinus. Okay, so let us write down all those things over here. First, it started off from the lateral ventricles. Lateral ventricles in the sense, what are the ventricles? 1 and 2 ventricles are called as lateral ventricles. Now, from the lateral ventricles, it entered into third ventricle. How did it enter into third ventricle? How did it enter into third ventricle? With the help of what? With the help of foramen of Monro. Foramen of Monro. Now, from the third ventricle, okay, from the third ventricle, then it entered into your fourth ventricle. Into fourth ventricle. How? With the help of aqueduct of Sylvius. Aqueduct of Sylvius. Now, from the fourth ventricle, what can happen? There are two pathways. So, this is one pathway which I did not discuss. There is another pathway like this. What is another pathway? With the help of, right? So, with the help of foramen of Luschka. Foramen of Luschka. And also remember one thing, I did not draw that foramen here because I cannot show it to you in this picture. Exactly where the foramen of Luschka is present, you see in the center here. In the center, in the midline, you have got another foramen like this in the center. This is called as foramen of Magendie. Okay. So, I did not write it, but I will write it here now. So, foramen of Luschka and Magendie. Foramen of Luschka and Magendie, where it is going to enter? It is going to enter into the subarachnoid space. Subarachnoid space. Okay. From the subarachnoid space, the CSF is going to enter into the subarachnoid granulations. Subarachnoid granulations. And from the subarachnoid granulations, finally it will enter into your dural venous sinus. Dural venous sinus. From the dural venous sinus, this would enter where? It would enter into your superior sagittal sinus. Enter into superior sagittal sinus. I hope you understood this pathway, right? So, this is one of the very important pathway which I want you to know here, right? These are some of the important things which I want you to know. So, let us have just a quick recap of whatever we have discussed here. We discussed that the CSF will start in the lateral ventricles. Who is secreting the CSF first of all? Yes, that is a choroid plexus. Choroid plexus, what does it do? It secretes the CSF, and this CSF first enters into your lateral ventricles. From the lateral ventricles, where does it go? It will enter into the third ventricle. From there it enters into your fourth ventricle, and from there it will enter into your subarachnoid space, then subarachnoid granulations, and dural venous sinus and superior sagittal sinus. So, this is the pathway of what? Pathway of the CSF that is passing. Now, there can be some conditions. What are these conditions? For example, if the CSF is more, right, you call this condition as a hydrocephalus. What is hydrocephalus? If there is excess amount of CSF that is present within the ventricles, you call this condition as hydrocephalus. There are two different types of hydrocephalus. One is called as communicating hydrocephalus, another one is called as non-communicating hydrocephalus. Now, what do you mean by communicating and non-communicating hydrocephalus? For example, let us say that within the foramen of Monro there is some kind of obstruction, whatever it is. There might be a stricture or any obstruction it might be. There might be some kind of congenital malformation or whatever it is. Let us say there is an obstruction. Now, because of this obstruction, what is happening? Are the first and second, can they communicate with the third one? No. Now, first, second has became separate, third, fourth and completely separate. Yes or no? So, such type is communicating or non-communicating. This obstruction is not allowing to communicate the first two ventricles with the third ventricle. So, that is why such type of obstruction is called as non-communicating obstruction. Now, because of this non-communicating obstruction, what is going to happen? From the choroid plexus, as usually CSF will be released. Now, can this CSF pass through this foramen of Monro and enter into the third ventricle? No. So, eventually what will happen? eventually the level of CSF within the first two ventricles, they keep on increasing. And what will happen? The ventricles will become enlarged. Can I call this condition as ventriculomegaly? Right, where the ventricles become enlarged. So if the ventricles are becoming enlarged, see this enlarged ventricles, when ventricles from all the directions are becoming enlarged like this, don't you think surrounding the ventricles, whatever structures we have got is a soft tissue structures. So don't you think these ventricles will compress the brain substance? All this is the brain substance, right? Don't you think these ventricles also, this excess amount of fluid in the ventricles will compress your pia mater, then subarachnoid matter, then dura matter? So don't you think patient will have very severe intense headaches? Right? Overall, if this is happening every day, little by little, if there is enlargement of the brain structures, when you look at the head of the baby, don't you think the head of the baby becomes too large? Right? Have you seen anywhere the pictures where the head of the baby is too large? Right? Macrocephaly. So that is mainly because of this kind of hydrocephalus. Okay. So what is this hydrocephalus called as? This is called as non-communicating hydrocephalus. On the other hand, there is another important thing called as communicating hydrocephalus. Communicating hydrocephalus in the sense, if you can see here in the center, there is no obstruction. You see, in the center there is no obstruction at all. Now, when there is no obstruction, still how hydrocephalus is happening? For example, if this choroid plexus, if they start secreting excess amount of CSF other than the normal, right? If they keep on secreting excess amount of CSF from all the choroid plexus, then don't you think the level of CSF within all the ventricles will keep on increasing? So when they keep on increasing, that is also hydrocephalus, but here there is no obstruction. All the ventricles are communicated with each other. So two ways. One is because of obstruction, there is excessive buildup. Another one is because of excessive synthesis of CSF also, there is excessive buildup of CSF in the ventricles, right? So there are two important causes, and this condition, by the way, as I've already told you, this condition you should call it as hydrocephalus. Hydrocephalus. Okay. So what is this hydrocephalus? Accumulation of excess CSF in ventricles is called as hydrocephalus. So there are two different types of hydrocephalus, as I have already told you. What are these two different types of hydrocephalus? One is called as non-communicating hydrocephalus, and the next one is called as communicating hydrocephalus. Non-communicating as well as communicating hydrocephalus. Now when it comes to non-communicating hydrocephalus, this is a congenital problem. It happens from the birth itself. Congenital problem. And communicating hydrocephalus is an acquired problem. Acquired problem. Okay. Next important thing is that this non-communicating hydrocephalus, what is going to happen? There is obstruction to ventricles or no obstruction? There is obstruction to the ventricles. Because of the obstruction, that is the reason why the ventricles are not able to communicate with each other, right? Now when you come across the communicating hydrocephalus, there is excess amount of CSF production. Excess of what? CSF production. What do you mean by CSF? CSF is nothing but cerebrospinal fluid. So there are two important things, excess production and another one is obstruction. So two important things. So very easy to understand here, guys. For example, let us say you see a room, right? This room is containing 10 taps. The room is completely closed, okay? There are no windows, nothing. It is completely closed. Only there is one small doorway, okay? So you need to, the only way to escape, okay, let us say not a room. Instead of that, let us say there is a very big drum, okay? You are sitting inside the drum, and within the drum there are 10 taps. Now when you on all the taps, what is going to happen? The water starts accumulating within the tap, accumulating within the drum, right? Now first important thing, if you wanted to escape out, what do you have to do? You have to open the door. Only when you open the door you can escape outside. But if you are closing the door, can you escape outside? You cannot escape outside. That closing the door is called as obstruction. You cannot escape out. Now when you cannot escape out, all the taps are open, the water keeps on accumulating, and don't you think this is called as hydrocephalus? Yes. Second important thing, let us say that door is open. Now the door is open and you have attached 30 more taps, and suddenly you have turned on all these taps. Then what is happening? Excess amount of water, even if the door is open, still the water which is coming inside, the water which is falling inside the drum is too much that the drum accumulates with the water very fastly, right? So this is what is called as what? This is called as communicating hydrocephalus. So this is what I have told you, non-communicating and communicating. So these are the normal ventricles which you can see over here. You see these ventricles? These are the first two ventricles. Now look what will happen when the ventricles have enlarged. You see, this condition is called as your ventriculomegaly. What is this condition called as? Enlarged ventricles. Enlarged ventricles. Okay, ventriculomegaly. You see, the ventricles are completely enlarged in all the directions like this. Right. So this is a condition called as ventriculomegaly. Right. So next important thing which you need. So these are all the important things which you need to know regarding the meninges as well as regarding the hydrocephalus, guys. So thank you so much for watching my video. Goodbye.